Hi, I'm Rory Hunter, Clinical Director at Fuente Hollywood Treatment Center. Welcome to Fact or Fiction, where we smash myths and spill truths on topics in queer culture. Today, let's shed some light on a topic that's often glamorized but not fully understood: poppers. So, what's the common take on poppers? Most people believe that poppers aren't addictive and not really a drug. So, people see poppers as relatively low risk. Is that true? Although not physically addictive, users can develop a psychological dependence. A lot of gay men, for example, feel like they can't enjoy sex without them. If you relate, I offer some ways to navigate this later in the video. So, what are poppers? Poppers are fast-acting inhalants, typically amyl nitrate, that cause your blood vessels to expand. Originally, they were developed to treat chest pains. They're now better known for their quick hit of euphoria, muscle relaxation, and enhanced sensuality. Amongst gay men, poppers help relax the body to make anal sex easier. Poppers have become iconic in LGBTQ culture, from Charlie XCX's gay rights moment with a bottle of Rush, a popular popper brand, to Troye Sivan's song Rush, to frequent appearances in shows like Queer as Folk. They're everywhere. You could even buy popper branded merch, t-shirts, pillows, even dog toys. While poppers aren't technically illegal, they can't be sold for human consumption. That's why you'll see them marketed as leather cleaner or room deodorizer. So what are the effects produced by poppers? Well, in addition to the immediate muscle relaxation and intense short-lived euphoria mentioned before, they also lower inhibitions and increase sex drive. But they do come with risks. These risks can include dizziness and lightheadedness, rapid heartbeat, facial flushing, headaches, nausea, impaired judgment and disorientation, and even temporary vision loss, which can be permanent with heavy use. The biggest and least discussed risk with popper use is combining poppers with ED medications like Viagra or Cialis. Both widen blood vessels, so together they can cause a sudden and very dangerous drop in blood pressure, which can lead to a stroke or even a heart attack. This has most commonly happened with people using Maximum Impact with ED medications. Maximum Impact is sold as a particularly potent form of poppers or popper spray. Although technically its primary ingredient is ethyl chloride, which is not the same as amyl nitrate, the risk of cardiac arrest from using it with ED meds is substantially higher, a risk that many people who use them together are completely unaware of. The risk is also higher when they are combined with another popular chemsex drug amongst gay men, GHB. GHB suppresses the central nervous system, so when combined with poppers and ED medications which cause the drop in blood pressure, you create a lethal mix, which some people is at least partially responsible for the tragic number of deaths amongst gay men. On a side note, it seems that a month doesn't go by that I don't see another post on social media announcing the untimely death of a 20 or 30-year-old gay man mysteriously losing their life for unspecified reasons. Those of us who are in recovery or who work in treatment know full well that young and healthy men do not drop dead at the rate we are currently seeing. The toxic mix of certain drugs, including poppers, could likely be a significant factor. Some other longer-term risks of popper use include brain damage affecting memory and learning and a weakened immune system. They can also lead to an increased risk of cancers linked to viral infections and, of course, rashes and burns around the nostrils, which in extreme cases can cause the collapse of your septum, something I witnessed for myself in a client I worked with a few years ago. So are poppers addictive? Well, not in the classic sense like alcohol, heroin, or GHB. With these substances, the body becomes physically dependent upon them, and they often require a medically supervised detox if you have been using them daily to minimize the dangers of withdrawal symptoms. Many popper users, however, do develop a psychological dependence, feeling like they can't enjoy or even have sex without them. The client that I just mentioned, whose septum collapsed, became addicted to poppers due to a career in sex work and believed he needed them to be able to work effectively. So what about poppers and the recovery community? Poppers have mood-altering effects, which can threaten those in sobriety or in long-term recovery from more serious drugs and alcohol. They can reignite cravings, especially for those with a history of using poppers with stimulants like meth, something known as cross-sensitization. What this means is you have an increased response to one substance after previous exposure to a related substance. This helps form a very powerful neural pathway of association, creating a psychological trigger to the more serious drug of choice. Popper use in sobriety can also encourage secrecy, bargaining, and shame, behaviors that do undermine the recovery process. They also keep you tied to the belief that you need something in your body to have a good time or to be sexually active. And recovery is ultimately about finding freedom without needing substances to feel connected, confident, or whole. Poppers are part of a broader party drug culture, alongside GHB, MDMA, ketamine, and crystal meth, which are all used within a chemsex context, which combines drug use with sex. Because LGBTQ plus social spaces often center around nightlife and parties, our community is especially vulnerable to the risks these substances bring. The good news is that you don't have to navigate this alone. At La Fuente, we offer specialized LGBTQ affirming treatment for party drugs and from recovery from chemsex addiction. We have over a decade of experience helping people reclaim their lives. We look at both abstinence and harm reduction approaches for drug and alcohol use, as well as for problematic or compulsive sexual behavior. We have honest, open, and most importantly, non-judgmental conversations with our clients so that together we can figure out what the right plan is for you. If you or someone you love is struggling, please reach out. Recovery is possible, and we all deserve it. Thanks for joining us for an episode of Fact or Fiction.